patient know exactly what I need him to do. You have to be really explicit on this, guys.
No camera hands on.
Hunter, I need you to take off your shirt, put this cape on, opening in the front, okay? Then you can lay down on this bed, this table. Let me get a pillow for you so you're comfortable. And I also need you to take out of your pockets any metal, a watch, your phone. No metal can be on your body right now. If you can even take off your ring, that would be a good idea, okay? So that goes opening in the front.
The metal plate in your hand, now let her know about that.
So go ahead and take your shirt off. I don't know if you want a gown or a screen. Don't look, he's changing people.
What if you have metal on the inside?
If you have metal on the inside, that will affect the ECG. That's okay, you just have to make a note of it, if he has a pacemaker. But he won't be doing ECGs if he has a pacemaker.
No, I know, but I mean like other, like sutures.
Well, like I have staples in my
Yeah.
arm. So I'm having an MRI today, and I said, you sure I'm not gonna have a problem with these surgical staples? She said, no, it'll be fine. I said, okay. So usually that's not an issue, but a pacemaker would be, or a hip implant, you know, that's metal on metal, that would be a big problem.
There you go, open it.
Hunter, you want a bandage for your nipple?
Thank you so much for offering. All right, Hunter, come lay down and get comfortable. You get to take a nap. The rest of them are gonna have to work.
Told you I volunteered.
Yeah.
Takes off his shoes. Aw.
Okay, are you comfortable, sir?
So much better.
We're going to cover him up with like a sheet or a drape. And we also have blankets to keep the patients warm, because you know the rooms are usually really cold. Okay, so this is our machine.
You can close your eyes.
Yeah, you can totally relax.
Pass out already.
First thing we gotta do is plug it in. If I can do it. Then I want to make sure I have the bed pulled away from the wall a little bit. So hold on for just a second. Whoa, that's good. Just so we're not picking up the electrical current in the wall, okay? The machine is waking up for us. Here are our electrodes. They come on a card. Don't know why they put that back. And there are 10 electrodes on each little card, okay? I need my gauze.
Smile, Hunter.
The most important thing you can do.
He's hardly asleep.
Where are my keys? Maybe she took them back to me.
So you don't want bandage on your nipple, Hunter?
You are contaminated. You need to stare. Jump in the autoclave.
Sorry, guys. This is the most important part of the procedure, is prepping the skin. If we don't prep the skin right, we're not gonna get a good reading. So I want alcohol, and I want 4x4 gauze. Gonna take a bunch. I'm gonna get it really wet.
This is the part my daughter hates and hated the most. It is
All
cold.
right, so if you had your sheet with you that I handed out, we're going to do, the first one is called V1. We find the clavicle, and then we go to the rib underneath it, and then the space. 2, 3, 4. So that's where V1's gonna go. Then we're gonna go down, kind of round his backside. He's really having fun now. Now, guess what, guys? Ladies have oily skin. No, I'm sorry, gentlemen have oily skin. Ladies have lotion. So you're gonna get some oil on the gauze. That doesn't mean they're not clean or anything else. That's just
Sure.
what you're going to expect.
Yeah.
Because I don't know about you guys, but I get out of the shower and I put cream all over.
Me too.
I better shave.
Always take one of those wipes.
Yeah. Everything.
Okay, so you've seen I've abrasively scrubbed his skin, okay? Now we're gonna put the electrodes on. These first 6 are gonna go facing down. So where do I count that first one again?
Under the clavicle first.
4
rib,
times,
and
4
give
ribs.
more. Yeah, under the gap.
So usually, it is about nipple level, and then it's on the right sternal border. Okay, so this is your sternum right here. V1 is gonna go on the right sternal border. V2 is gonna go just opposite it. It's gonna go on the left sternal border at the same height. Okay? You can make sure you've got that on good. Now we're gonna skip, that's V1 and V2. Now we're gonna go to V4.
Like a deal.
We're gonna skip 3. Right now I'm looking at the clavicle. Mid-clavicular is gonna be right about below the nipple. And this is the 4th intercostal space. I wanna go to the 5th intercostal space. Mid-clavicular. Now I'm gonna go back to V3 and draw a line between 2 and 4 and put it on the diagonal. Okay?
Sorry, Hunter. We need to
You see how hard it would be if we were doing a girl?
Yeah.
All right.
Sports ball and whatnot.
Yeah. Now, we're going to stay at this level, the 5th intercostal space now. And right in front of the armpit or the axilla is V5. And mid-axilla, bring your arm up a little bit, good, is going to be V6. So these 3 are on the same level. 5th intercostal space. These 2 are on the same level, 4th intercostal
And that
space.
one's in between.
And V3 is the diagonal.
Okay.
Okay, so we got 6 of them done. The last 4 are extremities. So that's easy enough. We want to keep this on the soft tissue. We don't want it on the bone. So we're going to put it right there. And it's still pointing down, right? So all of these upper ones point down. The only 2 that are going to point up are the ones that are down low. Now, yes, he has a lot of hair on his leg. It should be fine. But if this was on his chest, we'd have to probably shave his
Shave it.
chest,
Okay.
okay?
You gonna wax your legs, Hunter?
Whether you like it or not.
Girls actually sign up for this.
So
stuff.
there again, this is the shin bone. We want to be on that soft tissue, okay? And the little tabs are pointing up. Any questions on that, guys?
Soft spots of the arms, right? Not where the bone is.
Right?
Inside, so
Yep.
pointing up from the bottom. Okay. Good. Lots of stickers. Got it.
Okay.
This is the fun.
So, we usually, or I usually put this base unit kind of about their groin level. If you put it on top of their abdomen, it rolls off. So if it's kind of in their groin, it's a little more stable, but just be careful, ladies, when you're grabbing wires, you know what I mean? Okay, so
You know what I mean?
this, okay, if we start from the left side, these are not supposed to be tangled like this. This is gonna go on his left arm. I know that, or excuse me, right arm. This is his right side. So this one goes on his right arm. It's the
Clip the tabs, right?
you're supposed to clip the tabs if you can
Okay.
see what you're doing. Now this next one says V1. So it tells me exactly where I'm supposed to put it.
That was the first one, right?
That's the first chest lead.
Okay.
4th intercostal space, right side of the sternum.
Right.
Okay, the next one is going to be, what does it say? V2. V2.
Okay.
So we connect that onto that tab. Next one I want is, can't even see that, V3.
Three.
Make sure it's right. That's the order they go in. But sometimes they'll get twisted on you and trick you. Okay, V4. What level is V4 at?
Under the
Good.
fifth.
5th intercostal space, super. Now these are expensive.
Super perfect.
If the doctor sees you wadding them up and sticking them in a drawer, he will have a conniption. So you have to keep these untangled and treat them carefully, okay? They're very fragile. Okay, so there's V6. Now, you see how I'm kind of moving them? If I left this like this, it pulls the tab away from the skin. I want this to lay flat. So by doing that, it keeps, see this one's kind of sticking up? I need to adjust that too. So you want to keep these flat, otherwise they're pulling the electrode away from the tissue.
So
Okay.
abduction, not abduction.
Where is, okay,
We're gonna juice them up right now.
we are just in time, Carla. How'd that go?
I got a verbal warning written, but I told her about my schedule and it was alright.
Okay, good. I mean, I told her you're a good student.
I told her I'm gonna frame it.
Did you sign up for it?
Yes,
Oh,
that's
good.
done.
Okay, so we're all good?
Yeah. Hey, at least he doesn't have a lot of chest hair.
That's what she said. We'd have
It's
to
nice. So you know how to do this?
Yeah.
Good, excellent. So 6 chest leads, or we call them precordial leads, and 4 limb leads. Okay, so 10 leads in all. Now, not to confuse the situation, but this is a 12 lead EKG. So you're going, well, where does the 12 come in from? It's going to give us 6 pictures. Okay, it's going to show us pictures of those leads. Then it's going to show the 3 extremities as
There's 4
Three
extremities.
or
There's
four?
4 extremities.
there's really 3 extremities because the right leg is a ground, so
Okay.
it doesn't count.
Okay.
So we've got 1 limb, 2 limbs, 3 limbs. Then we have an augmented limb, which is, and I'll have to draw this on the board to explain it, but it's the electrical current going between 2 points. So like my right leg's the ground, it doesn't count. So my left leg and my right arm and my left arm. So it's called AVL, AVF. It's going to be this arm and this arm, the center point. Oh, this is way too confusing for day 1 for you, I'm sorry.
Good golly, yeah.
And it's going to go to the left foot. That makes no sense to you right now, but it will, okay?
It's like
These
an
two
electrical
center and then go to
current.
here?
Yes.
Okay.
Okay, so don't let that freak you out. Hi, how you doing?
Hi.
By next Monday, you'll know this and you'll understand it. So I usually don't touch on that the first day. So this is all you have to do, is learn how to get the electrodes in the right place, because if they're not placed right, that will affect the EKG. Then we've got this wonderful computer here. It wants to know, who's good on a computer? Anybody?
Hunter?
Right.
No, just kidding.
Come on, Hunter. You can lay there and type. Somebody step up and try this. It's real simple. It's a
ahead,
really
Brenda.
simple menu. Okay, so we want to just put in the date. This is enter. Okay.
Certain, and then it's go to another, that's a month that, so go back, right?
Yeah.
Go back, and the 7.
Oh,
to the-
07.
07,
Okay.
and then to the,
18.
18. 1 8. And 26 seems good. Okay. And we don't care about the time, so we'll just enter that. Keep going.
Sorry, I know we got the verbal together.
I'm done.
Good. Okay, so it's showing us a picture of our little man and all the electrodes on. And you see he's got a flashing electrode? That's what I'm telling you. This is a
Bad
great
connection.
computer. It says there's a problem with V2. V2 is securely attached to his chest.
Now it's giving you another one,
Oh, so it
Under-
was flashing?
his armpit.
Okay. Sometimes, does V2 look okay now? No, it's still flashing. So with this machine, we have a problem with V2 a lot of times. And I have to come to the base, pull it out, and put it in again. Make sure it's good. Usually that takes care of
Is the
it.
electrode actually flashing on the body? I can't
Yeah.
see. Oh, okay.
Okay, see,
Got
it
it.
took, my adjustment took. It took a few seconds for it to register, but we're good. Okay. So now, if you read the instructions, it says, if you want a stat ECG, a patient comes in and he's having chest pains.
So ASAP, right?
Yeah, we don't care about his name, his age, or anything else. I just want a stat ECG. It says, hold this down for 1 second.
Do that.
That is correct. Hold it down for 1 second.
yeah, this appear.
Yeah, but I want a stat.
Oh,
Okay, so he's analyzing right now. going to print. You're not supposed to move, sir, I forgot to tell you that.
But don't move.
Okay, so it has a little bit of movement on it. Let's do it one more time. Just hold still for a second. You can breathe normally.
Relax.
Let's say it
You go
says,
to exit first, right?
no, we don't have to do
I'll
that.
repeat the test.
Repeat the test, so hit 3.
Then, adjust again, adjust baseline future.
No, just hit number 4.
System for brings ECG.
Correct. Hold still now. So you can talk to the patient, he can move, he can do everything. You just have to tell him, just before you press the button, just to not move for a second. That's a little bit better, it doesn't have quite as much artifact on it. Movement will affect it. It gives it this chatter that you see. And then it says abnormal ECG. Inferior ST elevation, consider acute ischemia. Sinus arrhythmia. Okay, so he has a sinus arrhythmia. Good, we can look at that too. So remember I told you it had V1, V2, V3. Now V2 is the one I had to fix. If I hadn't fixed it, it wouldn't have shown up like that. So V1, V2, V3, V4, V5. It's kind of pulling funny. And V6. Okay, then you have the bipolar limb leads 1, 2, and 3. So this is 1, 2, and 3. And then we get into the augmented views. That's the crazy one that I'll explain later. But so there's 6 views of limb leads and there's 6 views of the chest. That's how we come up with our 12 lead EKG. In the old days, remember there was a stylus and it would just print out one current at a time and you had to switch a channel manually. This does it all for us. So it gives us 12 pictures, really quick and easy. Now, if he's not in chest pain, what we want to do is what happened?
Maybe,
Went to sleep.
Not supposed to do that. Okay.
yeah, it's on. That's
Okay.
that's a standby, and now it's on again.
Okay. So now what we want to do is we want to put in the patient information.
So
Well, let's hit
it's
1.
number 3.
Yeah.
Repeat the test.
No, let's do 1. Let's exit.
One. And ask press over ECG or ECG to stop.
Okay. So now we get to put in the patient information. So there again, any ECG is going to give you instructions like this, easy to follow, okay?
Cold winter?
Of course not.
After
You're
that
not cold,
alcohol
are you?
wipe.
All right, go ahead and enter his information.
Yes. So patient ID.
1, 2, 3, 4. And enter.
And last name.
Guess you didn't have to ask how to spell it, huh?
I was just gonna say that. They speak the same language.
They do.
Middle initial.
You don't need that. That's fine. You can just skip.
Monday, yeah. Monday.
June 8.
June.
We don't need to.
So 06,
Has it in the
8.
08,
As long as
91.
we get right, provided when-
1991.
It says on there, abnormal liver.
Weight, how many pounds? How much pound? How much weight?
Around 125.
Can I wait?
Okay.
No. What's wrong with that?
How
You
much
know,
weight?
if it's abnormal, I can run a second.
Seven.
Okay, I said.
So you guys can work in pairs.